people online. So I'm going to kick off by asking the panellists each to talk about or to describe what a successful clinical interaction and consultation appointment looks like to you. So I'd like to start with Jade, and then we're going to work down there. Unless, do you guys want to kick off with your checklist first? Okay, that's great.
I was actually hoping we could start with patient perspective.
Yes. Well, that's what I was saying.
I was like, you're the people we should be asking also.
Okay, so I think we should. So we'll refer that. Yeah. So we'll refer to Nikki and Kylie, because I know that you've prepared something, and I wasn't sure if you wanted it up now. Yeah.
So what we're going to start with is extra mark. Look, this is how I normally go to doctor's appointments. So don't think that I'm that OCD all the time. I prepared that. My normal checklist is this, but I'm usually able to remember everything. But when I started particularly dialysis and post-transplant, I blame my drugs for everything. It's not me, it's my drugs. I forget a lot of stuff, and I go to the doctors, and I only see some of my doctors every 3 or 6 months now because they don't want to see me too often. I get into doctor's surgeries and I actually forget everything that I'm going to need to ask them, scripts, going for other tests. So I have a list that sits somewhere where I can actually start writing them down probably 2 to 3 weeks before. And so I started with a basic outline, and then it went to Kylie, and we've kind of developed a bit more of a guideline. And then we spoke to Matt, who gave us some feedback as well from a doctor's perspective. And we just thought it might be helpful to sort of start the conversation around us having something. My doctors, skin specialists, all my team now expect me to come in with a list, and they kind of look at it because I kind of put it where we can both see it. And I've found that's just helped have conversations, and I'm not so anxious about actually walking out of there and thinking 2 minutes after I've left, oh crap, I forgot. So I guess we just wanted to sort of put that up there to sort of start the conversation. For me, I need to have structured points because I do forget. And yeah, for me it's just helpful. And we just got together some rough points that we kind of thought were important. And I guess the biggest one for me is going to doctors and having sometimes 8 things on my list, and you can't squeeze it all in. It's actually allocating the time and giving them a bit of a heads up as well that, yeah, sorry, I need a long appointment. It's going to be a long session today. So, yeah, Kylie, did you want to add something?
Yeah. So we also use a similar approach to this, but again, I was taking the same book in because to start with, we were taking notes, but then you didn't remember what was happening last time, so now I use the one exercise book that we take. The other thing that I do is the doctor might explain something and I think I've got it, and then I'll go, okay, so how will I explain that to Shane's mum? Or how will I explain that to Blake and Zoe? And I need to make sure that I understand it enough to be able to answer even just one question that they've got for me. So that can also sometimes be helpful, because the doctor, when you question it that second time, you can get a little bit more information, or in a way that makes it a bit easier to understand. And for me, next steps is so important. So what comes next after that appointment?
Yes, I like pictures. So often I'm a terrible drawer of a kidney, so I use actually Kidney Health Australia's resources online. Because one of the things that people come in, I see a lot of health professionals, they talk, but they don't communicate. And it's actually that information that comes out. You see the bewildered look on their face. So I guess I use a lot of written resources, put that down, and in Tasmania and many places in Victoria we send copies of all letters to the patient that we send to the GP, and it's forced us to actually learn to write our letters better, that actually reflects the patient consultation, our interaction in here and what we had discussed on actually what we shared decision, what we agreed on together. We would do this, but we wouldn't do that, because that's really useful for when I'm away at the next conference like this, and you have to see a different doctor. It's all written down there, that what we agreed last time, and you don't have to reinvent that same discussion again. So I guess written is really important. I like pictures. Unfortunately, many of my patients can't read. In Tasmania, high school only goes up to year 10. So one of the first questions I ask them is, if I write it down, will you be able to read it, or can someone in your house read it? So it is understanding the whole person and how best to communicate. And I think it's many different ways of doing that.
I think about this in sort of two parts. When I first saw the question, I was like, I don't do consultations, I don't know. But then thinking about it, there's the medical consultation that we think of, and a successful medical consultation from a nursing perspective is when my patients walk out and they're talking the same plan and the same language as what my doctor's been talking about, and we're all on the same page. That, to me, is a very successful consultation. Doesn't always happen. I also think successful when patients come out and they're not going, when I talk to them and they're like, oh, what did the doctor say about this symptom? Oh, I didn't tell them, or they didn't think about it. And I think having it written down is a huge thing, because many, many, many nurses will tell you about the many, many times patients have told them about something that's a big deal for them, but they forget to say it to the doctor. I think taking someone with you helps with that, not just having it written down. Not thinking so much about the medical consultation, but I was thinking about nursing consultations. In the area I work in, we have a lot of contact with our patients, and I think sometimes we don't think about that as a consultation, and we don't often think about that as the resource that it is. So I think sometimes bringing things up with the nurses that you're seeing a lot, the transplant coordinators that you're seeing, doctors in our hospital have about sort of 15 minutes to half an hour to go through everything in the last 3 to 6 months. The nurses you've got have more time, and you often have more access, so you often have a phone number to get a direct line to. So I think we need to use that as well and think about that for medical consultations as well, not just when I last saw the doctor, because there's some fantastic non-pharmacological stuff that the nurses know about that we can share, but if you don't tell us, we don't think to bring it up.
That's great.
Does that answer the question?
Yeah, perfect.
Thank you. I think that's raised some really important points about how we're communicating, about the role of the carer as a translator, not just back to the patient at another time, but to the whole of the support crew, and how we can use different resources, and it's not just about just handing someone a piece of paper and expecting them to just absorb it all and then immediately know what you're talking about. So that's what I've sort of picked up from there. So I'd really like to open it up to the floor now for questions. So Phil, and we'll try and get the microphone around. I think the microphones actually will pick up your voice, so we can let the roving one.
Just very quickly, that point about medications, my meds changed about a month ago, and I had to go and personally talk to my pharmacist, my GP, my renal psych, my clinical nurse specialist, and my hospital pharmacist to get all on the same page. And it was bloody exhausting. It took 2 weeks to get them all agreeing with each other about what my meds should be.
Yeah.
So it's not only a matter of us talking to our individual doctors, but getting the clinicians to talk amongst themselves and get, beats at the goalposts.
Does anyone else have any comments about medications? I agree. I think it's one of the biggest challenges, and errors occur because we just don't have a really good system for coordinating that. Helen?
Not all of us are lucky enough to just have kidney disease. Some of us have other things as well. And, oh my goodness, getting one specialty to talk to another specialty is, they don't, and so I've got to communicate, and that's great if I've got the language and the skills, but it's not my job.
Yeah.
I think on that note, something we share all our appointment letters with GPs and with specialists, but if we don't know who your specialist is, we don't know where to send it. We're very happy to send what we have and share it. We just tell us who your specialist is, and then we can send it to them. And our letters come with a medication list as well as what happened in the consultation.
I think that's a really important point about not adding to the labour of the patient, and not adding to their workload. Does anyone else have any comments about that point, or the checklist that the panel have developed, which I think is fantastic?
Yes, just on that notion of medication, I was once visiting a cousin who was on dialysis in a hospital, and while I was there, I witnessed a very sleepy person dialysing. I witnessed a doctor come along and say, "Oh, we're going to change that medication. Just don't take that one. Increase it from 20 milligrams to whatever," and went away. And I said, did you get all that? He said, oh, no. I said, well, hang on, don't you get that written down? No, not really. What are you going to do about that? I'll just ignore it, probably. But my point was I was concerned because he was so sleepy at the time. I didn't think it was a good practice, and I wondered how often that happened. I'm sure it doesn't happen in many cases, but that really bothered me.
I think that's where having the carer, like if there is somebody there to sort of advocate for you, if like, I know certainly there was sessions when I started peritoneal dialysis where I kind of don't remember what happened because I was feeling so unwell just before starting. And that's when it was really important to have, like my husband Neil, or to have my dad, who often did a bit as well, that they were that person that could absorb it, write it down, and then when I was actually feeling a little bit better, I was actually able to go, oh, okay, because I got that wrong. So I think that's where it becomes that it is very much, I think of it as a team sport, and that, you know, I can't do it alone because I'm often not well enough to necessarily take it all in. Sometimes I am, and I feel very able to be my own advocate, and it's like, yes, this is what I need. But other times, because we're so up and down and we have good and bad days, but especially on those days where we are bad and having to go, yeah, I'm really crap today, I need to have somebody else with me, which is not easy for me because I don't really like having to rely on other people. But I think that's where the carer-partner relationship comes in, whoever that is, because they can help us to remember that stuff, and they can also say to the doctors at different times, no, hang on, come back. We need to understand that a bit better. So it becomes that team. I call it a team sport, and everybody's got their role. So yeah, definitely.
Kylie, did you want to add to that?
Yeah, I agree, but also too, the roles change.
Yes.
So as you said, some days Nikki might find that she really is relying heavily on that partner, and on the days when she's feeling fantastic, maybe less so. And so as that partner, we kind of need to have to work it out.
Yeah.
What day is it? You know, what role do I need to play? So I just find the easiest way to do that is to say, what role do you need me to play today? How are you feeling? And then we talk about it, and then I'm clear, Shane's clear, but having that backup person, I think, is incredibly important, because I also find as well you can't often predict how you might feel when you're going through that treatment.
So we've got an online question. I know we've got some more questions from the floor, so we'll try and get to everybody because we've got a bit of time for discussion. Catherine, someone online.
There's a great question. So to the panel, if there is one thing you could change right now to improve patient and clinician communication and connectivity, what would it be and why?
Sorry. Is that all right? Can you repeat the question? Is that all right?
Sorry. Yes. So if you could change one thing right now to improve patient and clinician communication and connectivity, what would it be and why?
The one thing that you could change.
I might get shot for what I'm saying, but I think telehealth, definitely, and moving away from a clinic model. I know a lot of our funding comes from a clinic model, and seeing someone in clinic at this time, on this day, at this part of the hospital, and I just don't think that always works for patients. So I'd love it if we could move to much more of a telehealth. We could do things outside of hours. We can see patients who are working on a telehealth model after work rather than having to take a day off work and not having to come in for another appointment to see another specialist at another place. That's something that I would absolutely love. And working with IT, I don't know the legalities around this, but I know that a lot of patients I work with, we do a lot of email stuff, we do a lot of text messaging stuff, and that's what works. But I would love to have a platform that we can use beyond text messaging and email that can get written information across, can get pictures across for what we want, and it's very easy for people to access. So that's probably the stuff that I would love to change if we could.
I don't think anyone's going to shoot you down for that. I think they're going to cheer you for that.
And I'm the same. So I loved it when my 16-year-old patient who come from the Children's Hospital here in Melbourne showed me her patient portal, showed me all her specialist letters, and so as she's transitioning to adult care, I could see her entire thing. So she'd looked at that before coming in to the appointment in our young adult transplant clinic, but actually was really useful. Yet my adult patients didn't have that same access. So I think better use of technology, actually allowing people to look at their results, all of that, and then come in and say, hey, I'm not happy about whatever it is. And actually you've moved so far along and you've saved a whole lot of time, if it's together or if it's in fact telehealth, where, you know, when I did that with one of my patients recently, I'd forgotten it was school holidays and she was actually in Melbourne with her family at the playground, and I actually FaceTimed her with that, and I've been told that I'm not allowed to FaceTime her because it's not secure. So, yeah, so the better use of technology I think is really important for communication.
I'd agree, being from the country, because some of my specialists are 5-6 hours away. So certainly telehealth, and there is that, particularly being a transplant patient, I have multiple doctors in different facilities because they're not all in Armidale. Having a portal or having somewhere where I actually have all that together, where it's not me pulling paper or trying to make email files to get to people, would certainly make my life a lot easier.
And I think it reflects some of the comments that have been made about the financial burden of getting around to appointments and things, particularly if you're already spending a lot of time with your treatment, say if you're having haemodialysis. So, yeah.
If I can just add to that as well. So when I talked earlier about sort of being at every appointment, I should have clarified I'm not there in person for every appointment, but I'm always there. And so quite a few times, you know, it's Shane will go in and we know what time the appointment is, and then I'm dialed in. And so we still have a three-way conversation, but I don't have to physically be there. And that's worked really well for us. And our nephrologist, the first time sort of went, what are you doing? It was a bit new, but now it's just the norm. It's what we do. The other thing that I would also love, I mean, obviously we would love to see a cure for this thing that we're all living with. But further to that, it's I would love to see the systems that we use, and that's technology systems, but also the processes that are set in place. How much time do we spend waiting? You know, we're waiting for the next result or the next thing, and you go to that next appointment and, that hasn't come through yet. Well, why not? You know, this is what we're in the business of, so if there's a way that we can improve that, I think that will improve the experience that we have in every interaction with our team of professionals.
Penny.
Yeah. Further to, you spoke about visual and written stuff, but further to that, what does the panel think about recording consultations, whether or not it's a telehealth consultation or what do you think about the patients being able to, you know, stick their phone on the table and just press record, from a patient as well as a clinician's perspective?
As long as they tell me, I'd love them to. Yep. Because I know when I go to consultations, I don't remember everything that happened, so if they tell me, I would absolutely love them to. But that's just me personally. I can't speak for everybody else.
Yeah, I agree. I think if it's the person, the patient, who's actually wanting to record it, I think that's great. When it's, I've had a few people where somebody in Sydney who we teleconference in the family, you're never quite sure who's in the room, and that other person wants to record it, and yet I've actually got the mum or the dad here in front of me who doesn't want to record it. So there's some of those interactions which can be challenging, but I totally agree. I don't think you should say anything to the person in front of you that you don't want splashed on the front page of the paper. You know, so I think it should be open and transparent, and I think we all should be health professionals, and it's our job.
I agree.
Yeah, I don't have a problem. I think it's that very much that just putting it out there and it's open that this is what you're doing and who has access to that. And what happens to that it's not a shared thing, it's agreed on who's actually given permission and who's going to hear that. That would be my only,
Okay, Catherine, do we have anyone else online asking questions? No, we've gone quiet online. Anyone else in the room who'd like to bring something up? So we've got another comment here.
With recording, the other corollary to that, I had it done very effectively when I was facing a big treatment regime, and the doctor just said, right, it's my policy to record this because you need to hear it more than once. But when I send you the recording and you listen to it again, I want you to promise me that you'll email me if you've got questions, because you'll think of more things later. And I think that was actually the most powerful part of it, not just that he recorded it, but I had that access to later on. But the other really powerful thing that a clinician did for us once, rather than me wait for 6 months for an appointment to talk to my nephrologist, he had a 3-way call with me at my GP surgery. And this was long before Medicare funded that sort of thing. He just did it because it was going to be easier. And it was wonderful for me to sit there with my GP and him, and my GP remembered all the bits that I didn't. because I don't have a partner, I don't have a carer.
Yeah.
And I think there's a fair percentage, would you say, Jade and Matt, of people who don't have anyone else. So we've got to develop strategies for them.
Can I just also add on that point that because I live in Armidale and we don't have a lot of specialists, a lot of in the more rarer cases, what's been happening is that the GPs have the patient with them, dial the specialist and do telehealth in Newcastle, Sydney. And what happens there too is there's better communication, but there's also education of the GP, which actually makes it, because sometimes in the country we go to doctors and they go, oh, well, you know more about this than I do, and I'm like, oh, crap. So what happens is by actually having them sitting there with us and then the specialist might get off and you can have that conversation, but it's an open learning situation where we're all learning. And it's very open, it's visible, and it's not relying on a letter from the specialist because everything was actually done in an open forum. So we've found that particularly people who have more rarer conditions that really struggle to and can't afford to get 5-6 hours away all the time to see them, I think that's a really empowering thing for everybody in that situation. And the specialists actually know, the patient and the GP actually know what's going on, so it's more likely to actually happen. So yeah, I think that's important.
So I think there's some really important concepts about how we roll primary care into end-stage kidney disease care, which is often tertiary care. So we need to go back to that coalface. And also about the role of the patient as educator and some of those concepts that we had earlier about not adding to your workload. It's not your job to teach everybody else who's involved in your care. So that's really important. So we've got another comment from Phil.
Sorry, I don't mean to hog the microphone, but I want to take it from the micro level back up to the macro level. This session's been the most valuable I've been in for the last 3 days.
Apart from the one that you gave.
Oh,
in the main part of the scientific meeting where you were educating the clinical community.
And if we're going to talk about improving communication between patients and clinicians, we should be in every session of the whole conference, not just in the one-off ring-fenced little session here, which has been really valuable and really important. But I want to see at next scientific conference, when they have a session about haemodialysis, there's a haemodialysis patient as one of the speakers. When there's a session about some other scientific aspect of the research, there's a patient who's experiencing that firsthand as part of that conversation as well. Because that notion, thank you. That notion of being our perspective in front of those clinicians will help their communication skills, undoubtedly. It's when they start talking to each other and not to us, they lose track of what they're really here for.
So Phil, if you can pass the microphone forward to the young lady who is just about to tweet what you've just said. And so Talia, I know I'm putting you on the spot here, I'm really sorry, but would you like to tell people a little bit about your experiences at the International Society of Peritoneal Dialysis Conference that really has been a game changer for this sort of activity, and the momentum is growing for exactly what you're talking about, but Talia can give you an update on how it's growing.
Yeah, so hi everyone. I just can't say enough how much what Phil has just said is just so important, and the culture is changing. And last year at the conference that I went to in Vancouver for the International Society for Peritoneal Dialysis did exactly that. Every session had a patient or a caregiver there talking about their experience. They opened the session, they grounded all of the research that was being presented in their personal experience and in their own expertise on that subject. And I did an interview study with delegates from the conference, with patients and caregivers and with health professionals, and it was almost unanimous that everybody's experience and everybody's learning from that conference was so greatly enriched from having that there. So hopefully we'll get there here too.
Yeah. So Talia's writing that work up to be published to the kidney community, and it's something that we really plan to share. I'd like to just throw to Craig and Kevin to just maybe talk to us a little bit about how CanSolve CKD is addressing some of these issues in the work that you've been doing with them, about getting patients to conferences and getting them much more integrated in the the research work that's happening.
So CanSolve, we have our annual meeting coming up May 3rd to 5th, so a couple of weeks after we get back, we go to do that. And we do have like project meetings at the annual meeting, and that is where the project leads from each of the 18 projects get together and share about how the project's going, and most definitely the patient partners who are involved in the projects will be there to share their experience and how they're being engaged and how their advice is being utilized. But that's also part of, there's a research operations committee that's a part of CanSolve, and so there are a number of patient partners who review the projects as well, and so they will have a checklist to go through and provide feedback to how the project is doing, and if there's stuff that needs to be looked further into, that they'll make that recommendation and ask the project to provide feedback on that aspect. So I think that's a little bit about how some of the patients are engaged in CanSolve, and I'm glad that we were given the opportunity as well to come in and just speak to our experience and also a little bit to what CanSolve is doing and how we've been involved. So I don't know if Kevin, you wanted to share anything else about that, but that's about it. Sure.
I'll just say that the researchers and physicians and the people who manage CanSolve, they're really patient with us, because for consumers or patients who've been in the system to come into like the research side can be difficult for a lot of people, because the language is different. It's very complicated and complex. Like coming into a meeting like this for the first time, you don't know who the researchers are, you don't know who the physicians are, and everyone's looking at you, and you're like, what the hell's going on here? So it's, for me, it took a year to kind of get used to, the governance structure, all the different projects. Like there's 18 projects, and they're all like very complex in and of themselves. So, to kind of learn as we go, they're really patient with us, and we kind of get streamlined into our committees and our projects and our research. But yeah, everyone's, pretty valued, and, our perspectives are always valued, and, if there's changes that need to be made, we voice them. And, most of the time they'll listen, and, yeah.
Thank you. So I know we're at time, but I know that we've got one more question at the back and one more online. So if any of you have got any other burning questions, I think we'll just maybe extend for another few minutes. We're not going to get kicked out of the room, and I think we've got a good discussion going, so we'll just keep going. So a question at the back?
Well, it's actually more of a statement than a question. I'm sorry, Shilpa. So Jonathan Craig's my name. I'm sorry I've come in late, but I'm the president of the Australian-New Zealand Society of Nephrology. And so the question was asked, or the comment was made, that we have to be in at every session. So a observation, the two talks that I have learned most from this meeting was Nikki's talk, where she spoke about her lived experience, and then two very brief talks, one by a 7-year-old and one by a 16-year-old, who explained what their lives were like with kidney disease. And they summarised in very few sentences, without jargon, the most compelling case that I've heard in a long time, much better than many of us who have been in this game from a clinician and researcher's perspective for decades. So what I'm here to say to you on behalf of this society, the local society, is we're absolutely committed to this. That 2 years ago we had no consumer voice in our annual meeting. In Darwin 2 years ago it started, it increased in Sydney, and we're committed to a much stronger voice and making sure that that is routine business. We absolutely agree we have to have everybody in the room so that we can learn from each other. And it's not just about you learning from researchers and clinicians, it's absolutely the other way around. So what I would look, but we don't know how to do this, okay? So this is a journey of discovery together. So we're looking forward to specific recommendations from you about what that would look like.
Thank you, Jonathan. Online question.
Yes, so this fits very well with what Jonathan has just said, and I just want to point out that it's from Oxford in the United Kingdom, the question, so that's fantastic. And it's more, I think, to the researchers in the room, putting a little bit of pressure on there. So is there enough emphasis on quality improvements, or what and how research has a positive impact for patients as opposed to benefits to researchers and their careers?
So I'll throw to Matt for that, because we just discussed this issue before this session started.
Yeah, so that's an excellent question. Thank you, Oxford. So I guess the question we all ask now is, who's it benefiting? If you're actually going to go and look at something, you know, what is the benefit and who's actually benefiting from it? There's so much research wastage where people are putting out papers and grant money is going around. So that's where it's about who's it benefiting. And then the next question is, who should decide where the money goes and what are the priorities? And we saw before some of the excellent commentary around research priorities that were presented. So I think we're in this phase where we are moving along towards that. And when Angela showed the song outcomes, I couldn't help but stop and think about my problem list that I as a doctor write: chronic kidney disease, diabetes, heart disease, blood pressure. Many of those outcomes actually weren't on my problem list, and so therefore they're not coming up time and time again. I don't keep on asking about the itch. I ask people to fill in an IPOS survey before they come in, similar to the Edmonton one, so we can actually look at it, but it's not on my problem list. So I think we all learn off each other, but it's a really important thing to actually come back to why are we doing this, who's it for, and the comment there, I think it's really powerful that we should actually have a patient partner, a consumer, whatever you want to call them, in every session. And I think many of the clinicians I see here in this room, they're already converted to that space.
Yep.
Where you're not doing is the other 3,500 people at this meeting who aren't in this room.
That's all right. That's a task for us, and you know, as a community and a voice like this, that's the change that we can make, and that's the cultural change and the paradigm shift that we're looking for. So,
can I just make a comment, because I've been fortunate enough to be a patient partner on a lot of startup research projects and involved in stuff, and the thing that's really struck me, because I'm pretty blunt, is how genuine that desire is to have our input, and that we do have the ability to make change. So it's really important that there are amazing researchers, and a lot of them are actually in this room, as Shilpa's saying. It's not necessarily the people here, it can be some of the others. But what has struck me is the genuineness of people wanting things to be better, and people want to know what we want and what's important to us, but not even what's important to us, what's important to our partners, to our children, and to the things we do. So I think the revolution is starting, and you know, we need to be a part of things and put our hands up if we're asked for an opinion or asked to fill out something or to be involved where we can. Be a part of it, have a voice, and say it quite loudly. Don't be shy in what you've got to say, because that's your experience, that's what you own, and that's really important that we get it out there, because people want to know. So people want to know.
Yeah.
And it's not just research.
No.
Yeah.
I've been asked onto the clinical network as a consumer rep for all the nephrologists in Queensland, which I was gobsmacked at when they asked.
Yeah. And it's about the clinical community actually valuing that time and input and the labour and the effort that you volunteer. Robert.
Thank you. Robert Gardos from BEAT-CKD Australia. I'd just like to make a suggestion to everyone, patient, carer, health professional. The question should not be, can we do something? The question should be, how can we do something? If it's can we, the simple answer is either yes or no. Yes. But if it's how can we, then we will find a solution. So that should always be the question. If it's a good idea, that's the question that should be asked.
Fantastic. Thank you. Thank you. All right. It's been a really long session, so I will just ask for any final comments to the panel or any final comments that the panel would like to make. Okay. So look, thank you all. Thank you to everybody who's come today, in person or online. We've got hundreds of people online. It is just amazing. Thank you to all the speakers. It's just been really fantastic. I'd like to thank the BEAT-CKD Consumer Advisory Board. They're a group of really committed patients who've come together, who've actually told us how to do today, have helped select the topics, set the agenda. That's really, really important. I'd like to thank the ISN for letting us have this, and again to Baxter for sponsoring all the live streaming and the videos. But in particular, I'd like to thank Emily Duncanson. And where is Emily? Emily is the absolute tour de force energy that has brought all of this together. She has put so much work and effort into it. There have been a lot of people involved, but I really do want to single out Emily. The whole BEAT-CKD team have been behind this. So thank you all. Now, just to remind you that the entire session has been recorded and is up on the BEAT-CKD YouTube channel. Those of you who have registered to be here today will receive a lot of information, and that you've also got online or in-paper evaluation surveys. Now, it's really, I cannot emphasise how important it is that you do that evaluation and give us the feedback, because without that, we don't have a mandate to move forward on all of the important initiatives that we're trying to pull together here. So please, you can do it online. You don't have to do it right now, but please make sure that you get that feedback back to us, not just about how great this was, which I think it was a fantastic session, but what we can do better, what we didn't do well, and how we can improve things for the future. So thank you all. Thank you for participating. Thank you for coming, and we'll look forward to seeing some of you, if not all of you, at the next meeting. Thank you.
Let's start somewhere, yes.